If you decide to get a health insurance plan today, one of the problems you're going to be facing is a problem of reading and understanding the health plan, because when you need a health insurance, you always end up contacting different HMOs, and they will all provide you with multiple options that might warn you out and getting you confused. So in this video, I am going to guide you step by step on how to read and understand the health insurance plan, which you are going to be using to compare between different health insurance plans whenever the need arises. But then we are not going to be using or generating information randomly. We are going to be using an actual health plan from one of the prominent health insurance in Nigeria, and what we are going to be looking at is the price of the health insurance, the hospital that is going to be covered under this health insurance, and then the outpatient surgeries, maternity, and also fertility care. But now the good thing is that video and information will feel so real, like you're the one reviewing, and whenever it's time for you to get a plan, either renew, you have no cause to panic about anything. And if this is your first time on this channel, you're welcome. Please endeavor to support this channel by liking and subscribing to the channel, and share with someone that needs to hear it. And make sure you watch this video to the end, because I'm going to be comparing the premium 89,500 to the total package, total value that you're going to be getting from this health insurance. And mind you, this is the insurance plan that is meant for one person. It is a basic plan, which means it is the least health insurance plan for this company. That does not mean any other company might not offer more or offer less. So stay tuned and we get into the video right now.
Okay, so we go straight into reviewing and learning how to read the plan. Like we said, this is an actual health plan from one of the prominent HMOs in Nigeria. And like you can see, we'll start from the price, which is the premium for every health insurance. Is the price for this health insurance is, as you can see, 89,500 so per year. So it means that it covers up to 12 calendar months. So if it doesn't mean either you start from January to December, if you start any of the month in the calendar year, it's going to end, it must cover 12 calendar months. That is what it means here. And then if you check that this is for the whole year, and then the benefit that we are going to be seeing here, as you can see downward, like you said earlier, this is a private individual health plan. So it means that if you're buying this kind of plan, it is just for you, not your family. It doesn't include your family unless it's a family plan. So that is what it is. So now the first thing, like we said here, is a premium, which is 89,500. It covers for the whole year. And the advantage of this plan is that you can pay quarterly or monthly, or you make a one-time payment. That is what it means. And then it makes sure that it fits in your payment plan to make it convenient for you to cover. That is what it means. But then this is one of the basic plan for this HMO. It does not mean that other HMO will not offer more or less. This is what it is for the basic plan for this HMO. So that is why it is important that when you're reviewing other plans, you compare and contrast, and then make sure it aligns with your health need at that point in time. So going further, but if you check, divide this 89,500 by 12, you now realize that what you're paying is just peanuts. Check that out and compare the cost of paying the huge bill in the hospital. So going further, we realize that we have the region of cover, which is the hospital cover. Now on this health plan, you have access to 1,200 hospitals that you can roam about, use. What the roaming means that you can use any of these hospitals at any point in time. It must not be that you have to be registered in Abuja to use the hospitals in Abuja. If you are in Guzape and you need in Abuja and you need to access care there, you can use the hospital on that network. So it is very important that you become very familiar with the hospitals on that plan. And then also we move further to the outpatient services. Now this is a very vital part of any health insurance. Every health insurance, or most health insurance, starts with the outpatient services. Now what the outpatient services mean is that over the period, if you have to go to the hospital and see a doctor, get consultation, and go take medications and go back home, take your drugs and go back home, that is what the outpatient means. It means that you will not be admitted at all. You go to the hospital, see a doctor, back home. That is what the outstation means. And then what is covered, the cap for this outstation care for this HMO is 150,000 naira. It means that everything that requires you not being admitted in the hospital is under the cap of 150,000. If it requires that, if it spend outside of that, it is no longer covered. It has to be from your own pocket. That is what it means. So, and then the benefit that are entitled under, you're entitled to under this outpatient services include outpatient care, you go to the hospital, you get the treatment, general and specialist consultation when you see doctor, x-ray, that is radiology and x-rays, laboratory tests and diagnostic tests too. So it means, and then for every health plan, you are going to realize that there are different formats, but in this format, you see that they are like the thick line there, which is here. This one, you see that it means it's covered. So when you see anything is thick, like marked, it means that that particular benefit is covered. So take note when you're reviewing any health plan. Then you see that we have primary care and then consultation as well is covered. We have ENT, that's ear, nose and throat care, is covered under this plan. We also have prescribed medication when the doctor see you and write medication for you, right? Drug for you, it is covered under this plan. So one thing that I want you to understand, very important, is that this 150,000 is just for outpatient services. It means that every care within this particular amount is capped. So if you have to go to the hospital and come back, this is what they are going to pay for you within that 1 year. So it means that it doesn't mean that you won't access other care. And then the next one here is inpatient services. Now the inpatient services simply means when you are admitted in the hospital. And then if you observe, you realize that the medical limit, the inpatient limit here is 350,000. So it means when you are admitted in the hospital, what the HMO will be paying for you is 350,000 naira per annum within the year. So it's different from when you are not admitted in the hospital. You understand? So that is what it means. And then the benefit that you are eligible for under this inpatient services when you are admitted in the hospital simply are just x-ray, laboratory diagnosis and a host of others. So if you observe, you realize that the benefit for this inpatient are almost the same for this outpatient services, but the difference is the situations where they have to make the payment for you. So if you are in the hospital admitted, you are eligible for 350,000 naira, but if you are in the you go to the hospital and they treat you, the bill will be deducted from the 150,000 naira. But if you go to the hospital and you are admitted, the bills will be deducted from this 350,000 naira. That is what it means, and these are the benefits that you are eligible for. It is very important that you have this information at heart so that you know that whenever you are taking care of your healthcare or making payment or you're choosing a health plan, it aligns with what you are looking forward to. And then the next section is the surgical services. Now, the surgical services have the cap of 250,000 naira. What it means is that you are eligible to minor, intermediate, and major surgeries, and then also other procedures. So it means that when you go to the hospital and it requires any form of surgery, this is the amount, the highest amount they are going to pay for you, whatever the issue may be. So it means that if you know maybe you want more coverage, you get a higher plan. But for this particular plan, that the premium is 89,500, this is the amount that will be paid for you on your surgical services. And then the next one is the maternity services, and which covers antenatal, delivery, and postnatal care. Now, there is something in bracket here that you need to pay close attention to. It's called moratorium applies. What it means is that this benefit will not be available for you until after 12 months. So in most cases, what it means is that the benefit will be eligible after you renew your health insurance. Very important, because most people make this mistake when they just go and buy health insurance. Maybe their wife is pregnant and then they want to play smart with the health insurance company and cover it. It will not work. And these are the situations where people say, oh, health insurance, no, they work. It works. Now you know, understand what you buy. So make sure you watch this video to the end so you get all those details clarified. And then the cap for the antenatal and maternity service is 250. It means that from the antenatal care, the delivery, and every consumables that they're going to pay for you on this plan for 1 year is 250. Anything outside 250, you are going to pay yourself. That is what it means. And then we have dental care, and then for the dental care, what you are eligible for is the you can see here is primary, secondary, and dental care. So it covers up to 10,000 naira. For some persons, they might choose to, oh, let me use this 10,000 to scale my teeth, which is okay. Normal, it's your benefit. So if you want to do that, you go ahead and do that before the year ends. That is what is entitled to your care. And then also, it doesn't require only just cleaning and polishing. You can also treatment of infection, extraction. There's a lot of dental care needs you may have. But the point is that you have a cap of 10,000 naira per annum. So, and then we have optical care, which is the next care here, which is the eye care, which requires test, eye center, and then binaural optical lenses. So it means that if it requires lenses and the rest, the cap is up to 7,500. That is what they are going to pay for you on this health plan. So whatever if it exceeds that, you know that you have to make the payment yourself. So this information and then is what you need to know. And then the cap, like you said, 7,000. This is what it requires. Next section on the health plan is the ENT. That's the ear, nose, and throat section. Now, if you observe, you see that there is no particular cap here for this. The cap for this surgery is part of surgical limit. It means that if you have to access any care under the ear, nose, and throat, it means that it will be deducted from your surgical limit. That is where the balance is taken from, like the bill. Let's say you go to the hospital and you spend 10,000 naira, it will be taken out of your surgical limit. That is what it means there. And then also, we have other benefits too, which include accident and emergency. It means that when you have an accident at home, on the road, or within the coverage of this health insurance, you can call emergency ambulance to pick you up and take to the hospital. That is what it means. It is covered under this particular plan. And then evacuation, home, hospital to office, which is means from road to office and then hospital to office. So that is what it means under this plan. These are the benefits that is covered. And then if you observe, you see that we have a red cross sign here, which means it's not covered, which means it's something that is not covered under this plan. And what is telling you now is evacuation, and what is telling you is additional immunization, hepatitis B, yellow fever, and a host of others. They are not covered under this plan. Take it very, very seriously, because when the time comes and you reach out, they will not cover it. These are the things you need to pay attention to. They are called exclusion. Just like in the issue of maternity care here, where we have antenatal care and then moratorium applies. Now the moratorium is just simply waiting period. That is what it means. So take note. So these are the exclusion on this plan. It is red. It's not included. So when you see any red on anything, different HMOs use different formats to express or write them in their plan. So but what the most important thing there is that it's part of the exclusion. It's not included in this plan. And then you see that we have fertility services and then investigation only. Now for fertility services, it's only investigation they are going to do. So meaning that they are going to help, this insurance can cover up to tracing what is wrong with you. You understand, in your fertility, but it will not cover any other thing apart from investigating what is happening. So when you see a specialist or anything, it stops by with only investigation. And then there's also a cap on this investigation. It's capped under 20,000 naira only per annum. That is what it means. So in a year, for your health care on family planning, fertility services and the rest is covered under the cap of 20,000. And then we have HIV and AIDS to the extent of diagnosis plus treatment at free designated specialists. Now, what this means is that you have access to this HIV and AIDS, but it only has to be in designated centers where the treatment is free. But having an health insurance, they are going to direct you on how to go about it. That is the advantage. You won't be acting lost and be moving up and down and getting lost and be panicking. You get all the consultation you need, all the assistance you need from them. And then inpatient psychiatry cover up to 8 weeks. So you realize that it covers up to psychiatry hospital up to 8 weeks. So it means that if you're on this health plan and you're having a little you get it, it means that it can provide care for you for up to 8 weeks. Sometimes this psychiatric need that you might be needing, that might occur, might not be due to maybe substance abuse or anything, but it comes from stress. So these are the things that are very important, like you need health insurance. So breaking other health insurance plan on this platform, you realize that there are so many things, advantage of having a health insurance that you are going to be learning. So if you have not hit the subscribe button, it is not late. Hit the subscribe button, like the video so others can get access to this information. So thank you very much. And looks like we said, now from overall of all this information that we have gotten, there is something that is very, very important that you need to understand here. So now I want you to pay close attention to this information so you realize that you pay 89,500. Now let's look at the financial analysis from this health plan and the premium you're paying and the total value you're getting. So let's add up the whole limit of this health plan. So for the first one, you know that we are having 150,000 naira for outpatient services. We have 350,000 naira for inpatient services, and then also 250,000 naira for surgical services, 250 for maternity services, and then also 10,000 naira for dental care, 7,000 naira for optical, and 20,000 naira for fertility care. So if you add up all this amount, and then you realize that it sums up to 1,037,500. That is the total value you're getting from this health insurance you're buying, and the premium is how much? 89,500. So it means that the value is almost like 100 times, like it's so massive. So it means, and then if you divide the premium by 12, which is by monthly, you arrive at about 7,458 naira. So it means that your 500,000 naira that you have saved, you've used 7,000 naira to protect that amount in your bank as your savings every month, which is very, very smart when if you are thinking about how to protect your investment. So it means that your 7,000 naira has guided that amount, that 500,000, the 300,000 you have saved already. That is what it means. And the good and ideal thing is that it gives you access to better health care at any time, emergency cover, ambulance, and the host of others. So a very rational mind will always calm down and know that it is not okay to be penny wise and pound foolish. Protect yourself. And thank you for watching this video. Stay tuned for the next one, and hope you subscribe to the channel and support the information so you can get to others. Share with somebody and leave your comments. Any question you have as a comment in the comment section so that we can respond that. So thank you.